Hello, friends. This is Kike, your nursery Soros. How are you guys doing? So today I am going to be doing an asthma NCLEX review for you guys. So I'm going to start doing some NCLEX review for my audience right here because I know studying for the NCLEX can be quite overwhelming, and I want to put out as much resources as I can to help my audience, to help my internationally educated nurses. So the first one I'm going to do today is on asthma NCLEX review. And these slides have been created by me with some helpful resources to help put everything together. So let's get started. What's on today's agenda? We need to understand the normal function of the lungs, explain the disease process of asthma, nursing assessment of asthma, including the signs and symptoms. We're going to outline the nursing interventions for asthma and highlight patient teaching on asthma. So on the agenda, like I have everything that you need to know for the NCLEX on asthma. This is everything that you need to know. Oh, one more thing, pharmacology. So in my next video, I'm going to be doing the medication review for asthma. So that's the only thing missing here. I don't want the video to be too long. That's why I'm going to focus on this in this video. And then in my next video, I'm going to cover the medications that you need to know. So let's get started. For you to be able to understand the disease process, it's important for you to know how that organ works normally. Okay, so when you're studying, try to know, okay, how does this organ work on a normal day? Then you can understand better the pathophysiology, right? So, normal lung function. We know the lungs are very important for gas exchange, right? So, your lungs are the pair of spongy, pinkish gray organs in your chest. When you inhale or breathe in, air enters your lungs, and oxygen from that air moves to your blood. At the same time, carbon dioxide, which is a waste gas, moves from your blood to the lungs and is exhaled or breathed out. This process is called gas exchange, and this is very, very essential to life. The lungs are the centerpiece of your respiratory system. Your respiratory system also includes your trachea, that's your windpipe, muscles of the chest wall and diaphragm. There are blood vessels as well in your lungs and other tissues. All of these parts make breathing and gas exchange possible. Your brain controls your breathing rate, that's how fast or how slow you breathe, by sensing how your body needs oxygen and also how much carbon dioxide your body needs to get rid of. Okay, so that's just a summary of how the lung works on a normal day, and that's a summary of gas exchange for you. Okay, so what is asthma? What is asthma? I know this is not new for most people. You can leave a comment below. Let me just know your thoughts. What is asthma, right? And then we'll just explain right here. Just a few key points that you need to know on asthma. So it's a chronic lung condition. Asthma is a chronic lung condition. It affects the lung airways. There's so two things to note with asthma. There's always inflammation and narrowing of the airways. I need you to understand these two, okay? Inflammation and narrowing of the airways. And most likely it will start in childhood. Most of the time, it starts in childhood, and then even like that doesn't mean adults can't get it. Adults can also have asthma even towards adulthood, right? So, but most of the time it will start in childhood, and there is no medical cure. There is no medical cure for asthma except there's some supernatural intervention, which I honestly believe in, right? So some common triggers, is very important to know common triggers, because as you're looking after your patients, you need to also let them know these common triggers, and we're going to cover that very, very soon right here. So some common triggers to know is pollen. Polling can be like bee polling, exercise. There's a lot of triggers, right? It just depends on the individual. These are just some common ones that I have here. You can leave some other common triggers that you know in the comment box. Pollen, there's exercise, viral infections, cold hair, animal dander, pets can also be a trigger for some people. And then when symptoms get worse, it is called an asthma attack. Okay, so we're going to continue explaining asthma. So in asthma, the symptoms often follow a pattern. Okay, there's usually a pattern for the symptoms. They come and go over time or within the same day. Okay, they start or get worse with viral infections such as a cold or a flu. They are triggered by exercise, allergies, cold hair, or breathing too fast from laughing or crying. So emotions can actually trigger an asthma attack, right? That's very interesting. They are worse at night or in the morning. So I want you to really pay attention to these key points right here, okay? And usually when it starts, it peaks in 30 to 60 minutes. So it's actually, it's a very serious condition, okay, when the attack starts. So, what are some nursing assessment or signs and symptoms to watch for in your patients with asthma? And what do you need to know for the NCLEX? Shortness of breath. There will be wheezing. So, wheezing is a whistling sound when you breathe out. Chest tightness. Remember what I said initially, there's narrowing. So that tightness in the chest, there's narrowing of the airways. Cough, night and early morning is very, very common. Keep that in mind. And then when there's an acute asthma attack, all the symptoms progressively worsens. Very, very key. The symptoms will progressively worsen when there's an acute asthma attack, like nothing works. Nothing works, okay? And then there's decreased expiratory airflow. So that means the patient cannot breathe out all the carbon dioxide. So that's a problem because the carbon dioxide gets retained in the lungs and that can lead to respiratory acidosis. So that's another problem on its own. So the decreased expiratory airflow is due to bronchospasm, airway inflammation, edema, narrowing of the airways. And all these, if it's not properly taken care of and like it's very time sensitive, it can lead to hypoxemia. And that's just low level of oxygen in the blood. And then carbon dioxide, that is a waste gas, starts to build up, and that is a big problem. Other signs and symptoms to note are restlessness, absent or diminished lung sound. So when you auscultate, when you listen to the lungs, it will be there'll be diminished lung sounds. And they can also use accessory muscles to breathe. And there'll be cyanosis as well. So that's a bluish discoloration of the skin. If you would like to have a copy of my NCLEX review notes, head over to my website at thenurseresource.com, and go to NCLEX review respiratory. Click that, and then you want to go under asthma right here. Click that, okay, and then you want to download here. So I want the free NCLEX notes. You just have to put in your name and your email address, okay, and that should be good. Once you put in your email address, just click I'm ready to pass the NCLEX, and you will get the free download of the NCLEX review notes for asthma in your email address, okay. Check out my website. There's lots of, I'm still working on it, but I'm updating resources as time goes on. So check it out. Get your free NCLEX notes and let's pass the NCLEX. What are some nursing interventions for asthma that you should take note of as a nurse? You have to assess airway patency and respiratory status. So you're like assessing their respiratory rate. Usually their respiratory rate will be high. We don't want it to be too high. So what's the normal respiratory rate? Somebody leave it in the chat box. What is the normal respiratory rate? So you want to assess their respiratory status, airway patency, how are they breathing? That is super key. Also, you want to assess their vital signs, most especially their pulse oximetry. most especially their pulse oximetry. That is super key. What is the normal pulse oximetry, guys? What is the normal pulse oximetry? Let me know in the comment below. Also, you want to administer humidified oxygen by nasal cannula or face mask. Administer humidified oxygen by nasal cannula or face mask. You want to monitor their peak flow. So how fast can they blow air out of their lungs? So the picture you see right there is a picture of a peak flow monitor. Okay, there are different types, different brands. They are so cheap. So it's just to monitor how fast they can blow air from their lungs. And the higher the number, the better. Administer quick relief rescue medications such as bronchodilators, anticholinergics, systemic corticosteroids. I'm going to cover more on the medications in my next video, so you don't want to miss that. So for respiratory status or respiratory rate, we want the numbers to be between 10 to 20. So that's the normal. And then for pulse oximetry, we want their saturation of oxygen to be between 90 to 100%. I hope somebody got that correct. Okay, patient teaching is so important for the NCLEX, guys. You cannot run away from patient teaching. As nurses in Canada, we do a lot of teaching. So what are some teaching that you need to know? You have to tell your client to identify possible triggers and measures to prevent episodes. So it's very individualized. So what do they need to know? Right, what triggers their episodes, right? So make sure you like tell them, you hone it in when you're teaching them that, okay, if it's animal or pets, make sure you don't have any pets around you. If it's flowers, some people it's flowers, tell them, okay, you can't have any flowers around you. If it's I think sometimes some people with the season changes, like when we go from summer to winter, they get acute episodes as well. So you want to make sure they have their inhaler with them at all times. Okay, medication management and proper administration is another. Client education, correct use of a peak flow meter. So um, that's the thing that I showed you, the image that I showed you in the previous slide. They need to know how to use that correctly. They need to know about developing an asthma action plan with their physician. So they always need to be in contact with their physician to develop an asthma action plan. If they want to go for an exercise, they need to have their inhaler with them. Okay, the inhaler has to be with them at all times. What to do if an asthma episode occurs. So one thing to note for the NCLEX is that once they have an asthma attack and they use a rescue inhaler, and even if they get relieved, it's important for them to go to the hospital, because we don't know the extent of the inflammation in the lungs, and we don't know the extent of the narrowing of the airways. So that the attack can come again like pretty quickly. So it's important, like if they feel relieved, they should get to the hospital as soon as possible just to get an assessment done. Okay, so that's all I'm going to cover in this video concerning asthma. And then for my next video, like I said, I'm going to talk about the medications to use for asthma. Okay, so I'm introducing right here this NCLEX prep course, Apple RN classes, and I have my referral link in the description box below. You do not get charged extra for using my link. It's just to support my channel. This video is not sponsored by Apple RN classes. I just feel like this this NCLEX review course would be beneficial for my audience, and that's why I'm sharing, and I appreciate your support. Okay, we have come to the end of this video. Check the link below for the check the description box for the link to my referral for my referral link, pardon me. Check the link below for my referral link. And also, if you would like to print or have a copy of my NCLEX review notes, head over to my website at thenurseresource.com, and you will actually see under NCLEX review asthma, you will see like a box for you to download my NCLEX note. It's all free. Everything on my website is free for you to use and download. I just want you to excel and to pass your NCLEX, and let's nurse together in Canada. Thank you for watching. I'll see you in the next one where I talk about pharmacology NCLEX review for asthma.